As doctors, we get very bogged down in, medical minutiae and, what a patient's blood tests are doing or exactly what their weight is. But ultimately for patients, I think when they're living day to day, it's not those things that they're thinking about, it's their quality of life. And that's really the focus of SeeChange and, the difference that it makes for patients. From the moment they interact with the clinic, even before they walk through the doors, we really hope that they have a welcoming vibe from the practice. What separates us from other clinics is we really focus on a holistic approach for our patients. And what that means is trying to utilise multiple pathways of support, not just the surgery to assist someone with weight loss, but other things like a comprehensive dietetic program, access to psychology.
The holistic approach to weight loss means that we don't purely focus on the surgery and then expect patients to go off by themselves and hope for the best. And time again, when I see patients who have done really well with the surgery into the longer term, they've had access to all these other disciplines and they appear to get the best result in the long term.
Often we speak to people about non-weight related goals that they might have in the future. I think it's a really difficult thing to give someone a tangible weight goal to say, I want you to lose X number of kilos in however much time. I think it's far more realistic to say to someone, what do you want to be doing with yourself in 6 months, or how is your weight holding you back? And then how do you achieve those goals? The top priority for any patient having an operation with SeeChange is safety. Following surgery, patients are followed up quite frequently, and that's both with the doctor and also with the dietitians. We really try and take the focus off weight for patients post-operatively. We feel like a lot of patients have really struggled and grappled with their weight for so long. If they can have a discussion about quality of life or health measures when they're in their doctor's office, they find that quite refreshing. I had a patient the other day telling me she was climbing a mountain in Tasmania, something she would have never done before she'd lost weight.
The common things that patients will tell me is that they love having increased mobility. It might be that they can run around with their kids or their grandkids.
They're the kind of things we love to hear about as clinicians because they are real world changes for patients, true quality of life measures that have improved.